Today we are going to talk about veterinary antimicrobial drug classes. But instead of memorizing random drug names, I want you to think like a clinician. When you choose an antimicrobial, the question is not just, what drug kills bacteria? The better question is, what type of bacteria am I targeting? Where is the infection? What species am I treating? Is this animal young, pregnant, dehydrated, septic, food-producing, or at risk for a serious adverse effect? That is how drug classes start to make sense. Let's start with beta-lactams, which include penicillins and cephalosporins. These drugs interfere with bacterial cell wall synthesis, so they work best against bacteria that are actively dividing. They are generally considered bactericidal, meaning they kill bacteria rather than only slowing growth. A practical way to remember beta-lactams is cell wall drugs. If the organism does not have a cell wall, like mycoplasma, beta-lactams are not useful. Penicillins are often strong against many gram-positive organisms and some anaerobes, depending on the specific drug. Amoxicillin clavulinate adds a beta-lactamase inhibitor, which helps against some bacteria that would otherwise break down the drug. Cephalosporins vary by generation, but as you move through the class, you usually think about broader gram-negative coverage, depending on the drug. The big clinical warning with beta-lactams is that they are not automatically broad-spectrum miracle drugs. They are time-dependent, so maintaining adequate drug levels matters. Also, in food animals, you must be very aware of label use, withdrawal times, and legal restrictions, especially with cephalosporins. Next are tetracyclines, like doxycycline and oxytetracycline. Tetracyclines inhibit bacterial protein synthesis by binding the 30S ribosomal subunit. They are usually bacteriostatic, meaning they slow bacterial growth and depend partly on the immune system to help finish the job. Tetracyclines are useful because they have activity against some organisms that beta-lactams miss, including intracellular or atypical organisms like Ehrlichia, Anaplasma, some Mycoplasma, and some rickettsial diseases. In small animal medicine, doxycycline is one of the classic drugs you think about for tick-borne disease. But tetracyclines have important animal-specific cautions. They can bind calcium, so we worry about effects on developing teeth and bones in young or pregnant animals. They can also bind minerals like calcium, iron, and magnesium, which can reduce oral absorption. In ruminants, oral tetracyclines can disrupt rumen microflora, so you have to be careful with route and species. In cats, doxycycline tablets or capsules should not be given dry because esophageal irritation or strictures can be a concern. The practical memory hook is, tetracyclines are great for atypical organisms, but respect the gut, teeth, bones, and esophagus. Now let's talk about macrolides. Examples include erythromycin, azithromycin, clarithromycin, tylosin, tilmicocin, tulathromycin, and gamithromycin. Macrolides bind the 50S ribosomal subunit and inhibit protein synthesis. They are often thought of for gram-positive organisms, mycoplasma, and certain respiratory pathogens, depending on the drug and species. In foals, macrolides are classically associated with treatment protocols for Rhodococcus equi, often in combination with rifampin. In food animal medicine, some macrolides are important respiratory drugs, especially for bovine respiratory disease. But macrolides are one of the big, species matters, classes. Adult horses can develop severe, even fatal, antimicrobial-associated colitis from macrolide exposure. That is why even when treating a foal, you have to avoid exposing the mare. Rabbits and other hindgut fermenters can also develop life-threatening dysbiosis from drugs that disrupt normal flora. Some macrolides also have injection site or cardiovascular safety concerns, so this is not a class to casually use without knowing the label and species. Lincosamides, like clindamycin and lincomycin, are another 50S protein synthesis class. Clindamycin is very useful in dogs and cats for many gram-positive and anaerobic infections, especially dental infections, bite wounds, abscesses, and some bone infections. The caution is similar to macrolides in herbivores. Clindamycin may be useful in a dog with a dental abscess, but it can be dangerous in horses, rabbits, rodents, and ruminants because disruption of normal gastrointestinal flora can cause severe enterocolitis. So the memory hook is, clindamycin is great for dogs and cats, especially anaerobic oral infections, but do not casually use it in hindgut fermenters or ruminants. Next are aminoglycosides, like gentamicin and amikacin. These bind the 30S ribosomal subunit, but unlike tetracyclines, aminoglycosides are bactericidal and concentration dependent. That means they kill better when they reach a high peak concentration. They are especially useful for serious gram-negative infections, including some Pseudomonas infections, and they can work synergistically with beta-lactams in some situations. The major warning is toxicity. Aminoglycosides can cause nephrotoxicity and ototoxicity. So before using them, think about hydration, renal function, perfusion, and duration of therapy. A dehydrated septic foal, a blocked cat, or an animal with kidney disease is not the same patient as a stable, well-hydrated animal with normal renal values. With this class, monitoring matters. Fluoroquinolones are another major bactericidal, concentration-dependent class. Examples include enrofloxacin, marbofloxacin, orbifloxacin, and pradofloxacin. These drugs inhibit bacterial DNA gyrase and topoisomerase, interfering with DNA replication. They are often thought of for gram-negative organisms, some respiratory or urinary infections, and cases where culture supports their use. The key with fluoroquinolones is stewardship. They are important drugs, and they should not be used just because they feel strong. They are not reliable anaerobic drugs, and they should not be used when a narrower, safer option would work. In young growing animals, cartilage effects are a concern. In cats, enrofloxacin is especially associated with retinal toxicity and possible blindness, so feline fluoroquinolone choice and dosing require caution. In food-producing animals, extra-label use of fluoroquinolones is prohibited in the United States, so you must know the law, not just the pharmacology. Now let's talk about potentiated sulfonamides, such as trimethoprim sulfa. These drugs interfere with folate synthesis. When combined, the two drugs block sequential steps in the folate pathway, which increases their antimicrobial effect. Potentiated sulfas can be useful for a variety of infections, including some respiratory, urinary, skin, and soft tissue infections, depending on the organism. But they have classic adverse effects to remember. In dogs, sulfonamides can cause hypersensitivity reactions, keratoconjunctivitis sicca, blood dyscrasias, polyarthritis, fever, and other idiosyncratic problems. Crystalluria can also be a concern, especially if the animal is dehydrated. So with sulfas, think effective and useful, but monitor for weird immune-mediated or idiosyncratic reactions. Metronidazole belongs to the nitroimidazole class. It is mainly used for anaerobic bacteria and some protozoal infections. It is not a general diarrhea drug for every soft stool, even though it is sometimes used that way. From a stewardship standpoint, we should be careful not to overuse it when supportive care or diagnostics would be more appropriate. Metronidazole can cause neurologic signs at high doses or with prolonged use, including ataxia, tremors, abnormal mentation, and seizures. It is also prohibited from extra-label use in food-producing animals in the United States, so again, food animal medicine adds another layer of responsibility. Chloramphenicol and florfenicol are also worth mentioning. Chloramphenicol has broad activity and good tissue penetration, but it is a major human safety concern because of the risk of aplastic anemia in people. It is prohibited in food animals. If used in companion animals, handling precautions matter. Florfenicol is related but designed for food animal use in specific situations, such as certain respiratory diseases, depending on label and species. Rifampin is another special drug. It inhibits bacterial RNA synthesis and penetrates cells well, which is one reason it is used in some difficult infections, such as Rhodococcus equi in foals, usually with a macrolide. But rifampin should not be used casually or as monotherapy because resistance can develop quickly. It also has drug interactions, can affect the liver, and can turn urine, tears, or other secretions orange red. So if we zoom out, the big differences between antimicrobial classes come down to a few ideas. First, mechanism matters. Beta-lactams attack the cell wall. Tetracyclines, macrolides, lincosamides, and aminoglycosides affect protein synthesis. Fluoroquinolones affect DNA replication. Metronidazole damages DNA in anaerobic conditions. Rifampin affects RNA synthesis. Second, killing pattern matters. Some drugs are time-dependent, like beta-lactams. Some are concentration-dependent, like aminoglycosides and fluoroquinolones. Some are usually bacteriostatic, like tetracyclines and macrolides, while others are bactericidal. Third, spectrum matters. Anaerobic infections, urinary infections, respiratory infections, intracellular infections, skin infections, and septic patients may all require different thinking. You should not use the same favorite antibiotic for everything. Fourth, species matters. A drug that is routine in a dog may be dangerous in a rabbit. A drug that is useful in a foal may harm the mare. A drug that is fine in a cat at one dose may risk blindness at another. A drug that is legal in a dog may be illegal in a food animal. Finally, stewardship matters. Culture when appropriate. Use the narrowest effective drug. Consider local resistance patterns. Treat the patient, not just the lab result. And always ask, do I actually need an antimicrobial? Or does this animal need drainage, surgery, wound care, source control, fluids, pain control, or better diagnostics? That is the mindset veterinary students should build. Drug classes are not just names on a pharmacology exam. They are decision-making tools. Once you understand what each class does, where it works, and where it can hurt the patient, antimicrobial selection becomes much more logical.